One of the primary things is that the science around concussion is really young, and there's a lot of people putting a lot of time and effort into trying to understand both the acute injury diagnostics and management, as well as I think what a lot of people are asking are the long-term effects. I think some of what's been presented in the media is not entirely accurate, and so I think there's a fair amount of misinformation that's out there. So trying to dispel some of that, but dispelling it and backing it up with real evidence-based medicine.
The importance of concussion is not just a psychological issue, but actually a neurological, or as we like to say, a neurobiopsychosocial construct that involves everything from neurotransmitters in the brain all the way through to your family environment and the type of stresses you have as you're recovering from injury. From the clinical standpoint, when you're diagnosing it, you really need to have kind of three things. You need to have a mechanism, biomechanical force imparted to the brain. Okay? You have to have a temporal relationship of clinical signs and symptoms. So the force is applied to the brain, and sometime shortly after that, you get symptoms or dysfunction that you can measure. And the third component is, ideally, you don't have any other confounding cause for the symptoms, or at least that confounding cause isn't the predominant cause of the symptoms. And if you have those three things, I think then you're quite confident in the diagnosis.
I think the groups that are most at risk for sustaining concussion are those who are going to be participating in contact sports. Particularly within those who are in contact sports, regardless of whatever level of competition they're playing in, be it high school, youth, or collegiate, it's when there aren't safety protocols in place, when there isn't a plan for prevention to ensure that there's safe tackling going on during the practices, that there are athletic training, our sports medicine resources ready to help diagnose and detect the concussions if they do occur, and also to help manage the concussions when they do occur as well.
The primary one is symptom scale, a list of symptoms, and the athlete rates whether they have them on a scale of 0 to 6. 0 is none, and 6 is yes, and they, so from nothing to some significant severity, and so there's a list of symptoms, and so you can not only get a count of the number of symptoms, but also a figure for severity, and then you have that information, and you can repeat the tests from day to day and have some comparison in terms of, are the symptoms getting more or fewer, are the symptoms getting more severe or less severe, and so you can track them for day to day. Standardized assessment of concussion, which is a 30-point test, and it looks at orientation and concentration and short-term recall and long-term recall. And so you can use that to make an assessment. There's another test, Maddox test, that also is a more targeted concentration test that is especially useful in a competition setting, and then some balance testing as well.
Concussion prevention, you can kind of think about a pitch count, like for baseball. So, there's somebody keeping track of how many pitches the pitcher's thrown, and when they start to get close to 100, they pull them out. I think that that's something we can probably do with contact or collision sports like football and soccer when they're wearing sensors. But we have to know the relationship between hits and brain injury on scans. That's number one. And two, that we need some real-time way for the sensor to tell us what's the cumulative kind of second-to-second hit.
We do helmetless tackling training, and that is what we're trying to do, is leverage the vulnerability an athlete feels by actually not being protected, by not wearing a helmet, not wearing shoulder pads, and going into contact with a teammate, closely supervised drills and training to practice that that technique helps them to keep their head out of the way, because they are going to be more likely to want to protect themselves because they don't have the helmet on. So we're doing that as a training mechanism so that then during regular practice, full contact practice, scrimmages, and games, that even though the helmet is on, hopefully they've trained enough and had some motor learning so that when they're in those situations where they go into a tackle or a block or even a ball carrier and someone is coming at them, that they'll be more likely to keep their head out of the way.
Well, there's been a tremendous change towards more active rehab. And I think, at one point in time, people thought that you should rest until you became asymptomatic after a concussion. And that was really born out of concern that you might be doing damage by having someone exercise or do activity too soon. In addition to the fact that people are removed from play because you don't want them to have another injury, right? So there's sort of two things that were going on there. But I think what we're learning now is that activity is a good thing for people, and that if you rest people for too long, that they start to have more symptoms that are associated with anxiety or depression, because, especially if you're talking about an athlete that's used to exercising every day and exercising at a pretty high level, and then you don't allow them to exercise because they need to rest, that can end up having some negative effects. So there's much more of a move towards starting activity. Now the recommendations are for only, depends on the source, but anywhere from 24 to 36 hours of rest. And I always think about exercise kind of being medicine in a way that if you can get people back into some activity and get them to resume their normal things that they're doing in their life, that's part of that holistic approach that you would take in traumatic brain injury rehab.
Concussion research is important for many reasons. It is responsible for several million visits to the emergency departments in this country alone every year. But it occurs in young and adults and all ages, really. But it's become more of an issue in recent years in athletes because of the realization that it's more prevalent than we thought. And the fact that in athletes, certain athletes that have collisions like soccer and lacrosse and football and ice hockey, that repetitive hits to the head. Even in the helmeted sports like football, the brain is still able to move and the fibers can be stretched or torn. So injury or a frank concussion can occur.
Well, concussion research is important because, particularly for kids, is because it's an injury to the developing brain, and that research has shown that any sort of interruption of the development of a child's brain, any sort of injury, can affect the trajectory of their life, both social, educational, health, and so really it's an important developmental period for children, and so that's a lot of what we focus on is pediatric concussion because it is such a critical period of time.
Conferences like this are very important because we've been involved in research in this for many, many years. And what we found more recently is people are beginning to understand two things. One, what a concussion is, and two, how do you treat a concussion? And I think these are really important because when you understand what a concussion is, you can then understand how it's created and what happens to create risk to concussion. And I think that's where we are now, is that a lot of people understand what a concussion is, diagnose concussions more effectively, and so now they're looking at prevention. And of course, that's where the real opportunity lies.
We're focusing on a couple issues. One is how the standard of care continues to evolve in the area of concussion management. And because the standard of care continues to evolve, it makes it tricky for defendants to make sure they're meeting the standard of care. And I recently wrote an article that appeared in the Journal of Athletic Training entitled something along the lines of Legal Aspects of Concussions, the Ever-Evolving Standard of Care, in which I go through a number of recent cases that I've handled And the point of the article is because the standard of care continues to evolve, it makes it harder for defendants to make sure they're meeting the standard of care. So today I'll be talking about here's what athletic trainers, team doctors, and other clinicians and healthcare providers need to be doing. And I'll be talking about, first and foremost, how potential defendants in these concussion cases need to make sure they are following their concussion policies and following their concussion protocols.
Toward prevention. So much research is actually focused on increasing diagnostics and working on prognostics, helping identify objectively who has a concussion, and of those who sustain a concussion, how long will it take for them to get better. That's secondary and tertiary public health. We should also work on primary prevention and preventing concussions in the first place. And I think we'll see more and more of that kind of work also.
There's a lot of work being done in the field, but I think the two big things that I see coming is this idea of a biomarker. And so that'll be most likely some sort of blood-based marker that'll help with injury diagnostics. So something that can be used on the sideline immediately after a sporting injury or in the battlefield for our tactical athletes. And then the other end of that is when the individual has recovered. So when do these biomarkers clear out of the system and it's safe for that individual to go back to sport, back to work, back to school, or back to duty. So I kind of see the biomarker field as one area of a lot of attention that can be placed there. The second area are what are the long-term effects. So this idea of whether it's concussion alone, concussion with head impact exposure, or just head impact exposure without concussion, and whether that causes long-term effects, who ends up maybe having these declines, who doesn't, why that happens, and really trying to understand that. And that takes long-term prospective investigations that take 30, 40, 50 years to get the answers to. And so while that's how science is conducted, I think we'll get answers as we go along the way, but it's going to take some time to get the real answers.